Emeritus Professor of Global Health and Humanitarian Affairs at the University of Manchester. He's also a former Director of Emergency Response at the WHO. Always good to have you on the programme. Welcome. Tell us, has Omicron made the chances for vaccine inequality worse?
Well, I think the news is mixed in that we know that 2 doses of the vaccine are not sufficient. And so many rich countries are now giving boosters. Now, as WHO has identified, while people are on the 3rd dose in the West, many poor countries and poor people haven't even had their 1st dose yet. So how that translates into more variants taking place, and obviously the spread of inequalities, is a finely balanced calculation. And I'm afraid that what we're going to see in 2022 is that getting worse before it gets better. But there is a good side to it, if there is any good side to COVID, and that is if Omicron spreads rapidly throughout the world and displaces the much more lethal previous Delta variant, then it may mean that fewer people are going to suffer serious disease in the coming months.
Just to be clear on the science there, can Omicron completely displace Delta?
Well, it appears to be. I think certainly in Western Europe, and we know also from the earlier experience in South Africa, Omicron has replaced Delta quite rapidly. It hasn't replaced it fully. So what we're having now are 2 epidemics, if you like, one of the Delta variant and the other of the Omicron. But by and large, I think the rise of Omicron will completely displace Delta over time.
And, you know, as we always say, well, we hear that, you know, no one is safe until everybody is safe. When do you think that mantra will stop? When will that be, you know, just wishful thinking? When will that be a reality?
Well, I think where vaccines are concerned, there are record amounts of vaccines being produced. And more and more countries are beginning to produce their own vaccines. I heard recently that Turkey's now got a vaccine as well.
Yes, Turkovac.
And absolutely, great, well done. And similarly, there is accelerated moves to produce a vaccine or vaccines in Africa, where this really matters, apart, of course, from the vaccines we have in India, China, and Russia. Now, not all vaccines are equal, but most of these vaccines, if approved by WHO, have a significant degree of effectiveness. I see steady progress in 2022. I do not see this pandemic kind of becoming history in the coming year. But I would be very disappointed if the coming year doesn't bring us to the at least the end of the beginning of the pandemic. And then over the next 2 years, 2022, 23, we kind of move on. Helped perhaps by the virus itself, the coronavirus itself getting milder as the evolution progresses.
I really love those words. I hope 2022 is the end of the beginning of the pandemic. I hope when we speak again, maybe midway through next year, that will be a reality. Just very quickly, your thoughts on the amount of children, before I let you go, being hospitalized right now in the US with COVID.
The number of young people, children.
Yes.
Yeah. Well, I think we know this that younger people who haven't had the vaccine, because vaccines were not authorized for children until quite recently, and they're mixing more and more in schools, in the communities, and so on. And they haven't had so much exposure to the virus, so they're bound to get infected. And whether or not the increased reports of hospitalization been reported from a few places are actually verified by population-based studies, I think remains to be seen. I don't think we should panic unduly at the moment.
I love how you end with optimism and hope on the last day of the year. Always great to have you on the show. Mukesh Kapila, we wish you a happy new year. Thank you very much indeed for coming on.